Over 60? You may think that pink pill in your nightstand is helping you sleep or manage allergies, but it might be quietly disrupting the very part of your brain that helps you form new memories. Diphenhydramine, sold as Benadryl, is part of a drug group called Anticholinergics. These drugs block acetylcholine, a key brain chemical that helps with memory, learning, and alertness. As your brain ages, it relies more heavily on every bit of acetylcholine it can get. When this supply is blocked, memory loss, confusion, and even dementia may begin to accelerate. In fact, a 2023 study found that seniors who used anticholinergic medications regularly had a 54% higher risk of developing dementia. That includes over-the-counter drugs like nighttime pain relievers, cold and allergy meds, and even sleep aids. Many of these products include diphenhydramine without clearly labeling, often just as PM or nighttime. One woman named Carol, age 72, began taking an allergy medication every night to help with sleep. Within weeks, she noticed brain fog, forgetfulness, and trouble recalling simple words. Her doctor initially chalked it up to aging, but once she stopped taking Benadryl, her clarity began to return. So what can you do? First, check every label for diphenhydramine or similar ingredients. Avoid anything labeled PM or nighttime unless you've reviewed it with your doctor. If you're using it for allergies, try loratadine, Claritin instead. It doesn't cross the blood-brain barrier and is safer for older adults. If it's for sleep, melatonin or low-dose doxepin may be more appropriate options under medical guidance. Never stop any medication abruptly, especially if taken regularly. But don't assume that just because it's sold over the counter, it's safe for your brain. Coming up next, we'll look at a stomach medication marketed as gentle, but it may quietly rob your brain of the nutrients it needs most. Over 60? If you're taking something for heartburn or reflux every day, your brain may be paying the price. Proton pump inhibitors, like Prilosec, Nexium, or Prevacid, are commonly used to reduce stomach acid. They're often taken for years, sometimes even decades, because symptoms return the moment people try to stop. But few seniors are told that these drugs can severely limit your ability to absorb vitamin B12. That matters because B12 is essential for memory, focus, and clear thinking. Without enough of it, your brain cells struggle to communicate, leading to confusion, forgetfulness, and even depression. A 2016 study followed over 73,000 people aged 75 and older and found a 44% higher risk of dementia in those who used PPIs regularly. And the risks don't stop at B12. These acid blockers also interfere with magnesium and calcium, minerals that support healthy brain signaling and nerve function. Worse, recent research has linked long-term PPI use to an increase in amyloid beta plaques, the same toxic protein seen in Alzheimer's disease. Jack, 68, had been taking Nexium for nearly 5 years. He thought his memory issues were just normal aging, until blood tests revealed dangerously low B12 and magnesium. With his doctor's help, he slowly transitioned to safer options and began supplementing the nutrients he had lost. So what's the solution? If you're on a PPI, ask your doctor whether you can taper off with the help of an H2 blocker like famotidine, sold as Pepcid. H2 blockers are less likely to interfere with brain function. Also consider natural aids like deglycyrrhizated licorice, DGL, which helps coat and protect the stomach lining without shutting down acid production. Remember, stomach acid has a purpose. It helps you absorb critical nutrients. Suppressing it completely may bring short-term relief, but long-term harm. Next, we'll look at a bladder medication that's meant to give you control, but may be silently stealing your short-term memory. Over 60? If you're taking something for bladder control, it may be doing more than calming urgency. It might be quietly clouding your thinking, altering your mood, and erasing your short-term memory. Medications like Oxybutynin, often sold as Ditropan, are prescribed to help with urinary incontinence and overactive bladder, but they belong to a class of drugs that block acetylcholine, the same brain chemical essential for memory and attention. And unlike some milder options, Oxybutynin crosses the blood-brain barrier easily, going straight to regions that store and process memory. That makes it especially risky for older adults. In a 2019 study, seniors who took strong anticholinergic drugs, like Oxybutynin for more than a year, had a 49% higher risk of developing dementia. The effects often sneak up unnoticed. Some seniors report feeling foggy, emotionally flat, or struggling to recall names or appointments. Often, these symptoms are dismissed as just aging, when in reality, they may be drug-related. Betty, 74, began taking oxybutynin after frequent nighttime trips to the bathroom disrupted her sleep. Within months, she felt disconnected, anxious, and forgetful, but she never connected it to her bladder medication. Only after switching to a safer option did her mental clarity begin to return. If you're on oxybutynin and notice mental changes, don't ignore them. There are safer alternatives. One is mirabegron, sold as Myrbetriq, which works through a different pathway and does not block acetylcholine. It's generally considered safer for older adults and may offer bladder control without harming cognition. Always consult your doctor before making changes. But don't accept brain fog as just getting older. It may be something fixable. Next, we'll examine a drug millions take for heart health, but it might be starving your brain of what it needs most. Over 60? You've probably been told that statins are lifesavers for your heart. But what if they're quietly draining your brain of the very substance it needs to stay sharp? Statins like simvastatin, Zocor, and atorvastatin, Lipitor, are prescribed to lower cholesterol and prevent heart attacks or strokes. They work well for that. But cholesterol isn't just a heart issue. Your brain is nearly 60% fat, and cholesterol is critical for building the myelin sheath, which helps your brain cells send signals smoothly. When cholesterol levels drop too low, your neurons can't communicate properly. That can lead to memory lapses, confusion, and cognitive decline. A 2023 study published in Frontiers in Aging Neuroscience found that seniors over 70 on statins for more than 3 years had a 26% higher risk of developing mild cognitive impairment, and those on higher doses showed even faster decline. Some patients describe statin fog, where familiar routes, names, or conversations suddenly slip from memory. George, age 69, had been on a high-dose statin for 5 years when his family began noticing changes. He struggled to follow stories, repeat himself in conversations, and forget appointments. His doctor lowered the dose and switched him to a statin with a lower brain impact, and within weeks, his memory began to improve. That's the good news. Not all statins are equally harmful to your brain. Statins like pravastatin and rosuvastatin don't cross the blood-brain barrier as easily and are generally considered safer for older adults. If you're experiencing mental fog and taking a statin, don't wait. Talk with your doctor. Discuss dose adjustments or switching to a brain-friendlier option. And support your brain with healthy fats, like omega-3s from salmon or walnuts, which may help offset some of the cognitive stress. Up next is a medication that helps calm anxiety, but may sedate your brain into stillness and steal your clarity over time. Over 60? You may think that little pill easing your anxiety or helping you sleep is harmless, but it could be slowly sedating your brain and setting you up for long-term memory loss. Benzodiazepines, like lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax, are prescribed to reduce anxiety, panic, and insomnia. They work by enhancing GABA, the brain's natural calming chemical, to soothe overstimulation. At first, they feel like a lifesaver, but over time, the brain adapts and becomes dependent. That's when the real danger begins. A 2022 study from the BMJ followed over 8,000 seniors and found that those who used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. The longer the use, and the higher the dose, the greater the risk. That's because these drugs slow down neural activity. Your brain becomes less efficient, less flexible, and less able to form or retrieve memories. For many seniors, the changes come slowly. Joan, 75, started using lorazepam after a stressful event made it hard to sleep. At first, it worked wonders. But 6 months later, she noticed she was struggling to remember names, missing appointments, and losing focus. Her family worried she was developing dementia, until her doctor recognized the medication's role. They tapered her dose slowly, and within weeks, her mental sharpness began returning. The key word is slowly. You should never stop a benzodiazepine abruptly, especially after weeks or months of use. Work with your doctor to taper down the dose gradually. Safer options for anxiety include buspirone, a non-sedating medication that doesn't impair cognition. For sleep, cognitive behavioral therapy and natural aids like melatonin may help without fogging your memory. These drugs may feel like peace in a pill, but for aging brains, they can become a trap. Coming up next, an older antidepressant still widely used today, yet it may be one of the most potent memory blockers on the list. Over 60? If you're taking an old antidepressant for sleep, nerve pain, or mood, your memory may be paying the price. Amitriptyline, sold as Elavil, is still prescribed to many seniors. even though it carries one of the highest risks for cognitive decline. It belongs to a class of drugs called tricyclic antidepressants. But more importantly, it's also one of the most powerful anticholinergics in circulation. That means it blocks acetylcholine, the brain's key messenger for memory, learning, and mental clarity. The damage isn't just theoretical. In a massive study published in JAMA Internal Medicine, researchers followed over 3,400 adults aged 65 and older for a decade. They found that those who took high cumulative doses of anticholinergic drugs like amitriptyline had a 54% higher chance of developing dementia. Even low nightly doses taken for sleep or nerve pain can slowly erode memory over time. What makes this so dangerous is how subtle it begins. Margaret, 71, started amitriptyline for chronic back pain. A few months in, she found herself forgetting conversations and misplacing items she used daily. At first, she thought it was aging, but her daughter noticed the change, and with her doctor's help, they switched to a safer option. Within weeks, her memory started coming back. So, what can you do? If you or a loved one is on amitriptyline, ask your doctor about alternatives. For nerve pain, medications like duloxetine or gabapentin may help without the same level of memory interference. For sleep, low-dose doxepin, a cousin of amitriptyline with much lower anticholinergic impact, is often used safely in older adults. And for depression, newer antidepressants like sertraline or escitalopram are generally better tolerated by the aging brain. Always make changes under medical supervision, but don't assume an old drug is a safe one. Next, we'll reveal a so-called modern antidepressant that most seniors trust. But it may secretly block brain function even faster. Over 60? You might be on an antidepressant that feels modern and safe, but hides a dangerous secret for your brain. Paroxetine, sold under the brand name Paxil, is a type of SSRI, selective serotonin reuptake inhibitor, used to treat depression and anxiety. But unlike other SSRIs, it has a strong anticholinergic effect, which means it blocks acetylcholine, the same memory-supporting chemical disrupted by older drugs like amitriptyline and Benadryl. This one difference makes it uniquely risky for older adults. In a large 2021 review published in Frontiers in Psychiatry, researchers found that seniors taking paroxetine showed significant declines in short-term memory, word recall, and attention within just 12 months. Compared to those on other antidepressants, paroxetine users were 30% more likely to show signs of early cognitive impairment. That's not a small difference. That's a memory spiral hiding in plain sight. Eleanor, 68, was put on paroxetine for menopause-related anxiety and mood swings. She felt better emotionally, but 6 months in, she began forgetting names, losing focus, and repeating herself. Her husband noticed, and after consulting her doctor, she switched to a different antidepressant. Within weeks, her mental clarity started to return. Here's what you can do. If you're taking paroxetine, ask your doctor whether switching to a different SSRI is possible. Safer options include sertraline and escitalopram, both of which have minimal anticholinergic impact and are generally better suited for aging brains. Also, consider supporting your mood and memory naturally with B vitamins, especially B6 and B12, which play a key role in neurotransmitter production. Don't let the modern label fool you. Paroxetine's brain impact can be stronger than you realize. Next, we'll expose a class of medications originally meant for schizophrenia, but now given to seniors off-label, sometimes with devastating cognitive effects. Over 60? There's a category of medications you may be taking, and not even know it. Antipsychotics, once used only for severe psychiatric disorders, are now prescribed to many seniors for sleep, agitation, or behavioral changes. Drugs like quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, are often given off-label in hospitals and nursing homes. But these are not gentle medications. They were designed to treat schizophrenia and bipolar disorder, conditions that affect brain chemistry at the deepest level. And when given to seniors, especially those with memory issues or dementia, the results can be devastating. A 2022 study in The Lancet Healthy Longevity tracked over 25,000 older adults and found a 71% higher risk of cognitive decline in those taking antipsychotics, even if they had no prior dementia diagnosis. That's right, these drugs are sometimes prescribed to manage dementia symptoms, yet they may actually accelerate cognitive loss. The reason is how they work. Antipsychotics suppress dopamine, a chemical your brain needs for motivation, memory, and processing new information. When dopamine drops too low, the brain slows down, and people often appear dull, disconnected, or even zombified. Families describe watching loved ones fade emotionally and mentally, while doctors rarely mention the connection to the drug. Edgar, 76, was given quetiapine after becoming restless in a rehab facility. Within weeks, he stopped talking much, lost interest in family visits, and struggled to stay awake. Once the drug was tapered off, his personality and energy slowly returned. So what's the safer path? First, ask your doctor why the medication was prescribed and whether it's absolutely necessary. In many cases, behaviors can be managed with non-drug interventions. Consistent routines, better lighting, reduced noise, and addressing physical discomfort. When medication is required, doses should be as low as possible, for the shortest time needed, and family members should be fully informed of all risks. Up next, we'll reveal the most dangerous threat of all. Not a single pill, but a hidden combination silently destroying senior memory every day. Over 60? You may be doing everything right. Eating well, staying active, seeing your doctor regularly. But there's a hidden threat that could still be destroying your memory. It's not one medication. It's the combination of many, all quietly blocking the same vital brain chemical, acetylcholine. This is known as anticholinergic polypharmacy, and it's far more common than you think. Imagine a senior taking diphenhydramine for sleep, Oxybutynin for bladder issues, and Amitriptyline for nerve pain. Each drug on its own may cause mild forgetfulness, but taken together, their anticholinergic effects stack, and the result is brain function grinding to a halt. A 2022 study in Age and Aging analyzed data from over 280,000 seniors. Those with the highest cumulative anticholinergic burden had a 120% greater risk of developing dementia within 10 years. That's more than double the risk, and most had no idea these drugs were even in the same category. When you block acetylcholine from multiple angles, neurons start to shut down. They fire more slowly, misfire more often, and eventually shrink from disuse. This silent decay mimics Alzheimer's, but it's not inevitable, and in many cases, it's reversible. Lillian, 73, had been on 5 prescriptions and 2 over-the-counter meds, all with anticholinergic properties. She experienced confusion, word-finding trouble, and frequent disorientation. After a full medication review with her doctor and pharmacist, she weaned off 3 drugs and replaced 2 others with safer alternatives. Within 2 months, her mental sharpness improved dramatically. The fix isn't about quitting everything, it's about becoming aware. Ask your doctor or pharmacist to review your full medication list, including OTCs and supplements, for anticholinergic load. Tools and apps now exist that can calculate your total burden. Once you know, you can work together to safely taper off or switch to brain-friendly options. The brain is resilient, but only if you stop overloading it with conflicting signals. Certain medications can quietly erode your memory, especially when taken in combinations that block acetylcholine. Benadryl, bladder drugs, PPIs, statins, antidepressants, and antipsychotics each carry hidden risks. The most dangerous threat? Polypharmacy, where multiple meds add up to cognitive overload. But here's the hopeful part. Many cases of drug-induced brain fog are reversible. You have the power to change course. Now we want to hear from you. What medications are you currently taking? Have you noticed more brain fog, forgetfulness, or mental sluggishness lately? Comment below with your age and your current medication list. We're reading every message and sharing insights that may help.